Hey everyone, Dr. Raleigh Warren here today, and today we're going to be going over some tips, tricks, stretches, and things like that for when you have neck and call it maybe a little bit of shoulder pain, the neck pain going into the shoulder, okay? If you aren't already in something comfy, grab something comfy just in case, and I'm on my mat, so I'll meet you there. Cool. Okay, so just to clarify for the people that are finding this video, got sent this video, what we're going to be discussing today are people that come into the office, or if you yourself have dealt with this issue, whether or not you've come into my office or not. Types of pain we're going to be talking about or addressing as far as the things to go over today for tips and tricks would be the type of pain, often type I get is described kink in the neck, or I slept funny, those types of things where maybe you notice when you're driving it's difficult to turn and look over your shoulder, or you get the pain that kind of comes down from the neck into the top of that trap a little bit, also that sometimes comes back down into that shoulder blade. So if any of these pain patterns kind of fit what you're going through, then stick around because hopefully something will help you out today. Cool? First and foremost, one of the things that I give my patients when they're struggling with this type of pain, assuming that shoulder restriction isn't indicated, meaning you're able to freely move your shoulder, there's nothing impacting, impeding your ability to move your shoulder. So if you are that person that has problems moving their shoulder, or it's painful to really even like move your arms up and down, then maybe pause on this exercise. You can try it out, but if it starts to make things worse, exacerbate it, pause and maybe wait till things have calmed down. So one of the first things I really like to give to my patients is called hummingbirds. It's something I learned back in chiropractic school, and while maybe back then I thought it was a little funny and silly, as I progressed in my career, I realized it's something that not only helps with neck pain and reestablishing those muscles, it's also something that helps with posture, which is something that a lot of people come into my office as well. So one of the reasons I'm going to explain why I'm doing this after I explain it to you and show it to you. So first off, hummingbird is, I tell patients, you want to go into a 90-degree like goalpost kind of thing. The goal on this one is, again, if you get to this point and it hurts, maybe pause on this one and wait till you can get to this point. So the goal is you want to put your arms at 90 degrees. Here's the back side. So 90 degrees. And this one you want to go backwards. So you can watch my shoulder blades. You want to have the shoulder blades almost try and kiss each other. The rule on that one is you don't want to also go forward. This is not what I want. I want backwards. Again, it seems like a really dumb exercise, but after you do it for a couple seconds, you start to realize this gets really tight, and then between the shoulder blades might start feeling kind of tired or burny a little bit. So the reason behind that is a lot of the times, whether it's neck pain and or posture, which the posture can be implicated as to one of the reasons why you're having neck pain, but this is because these muscles, so your scalenes and your SCMs that attach to this collarbone, as well as your pec muscles, we tend to, in this society, be in this forward position. So what happens is it's not like your pecs and your scalenes and your SCM or sternocleidomastoid are strong, it's they're tight and short. So what happens is these become tight and short, and you see how that happens to open up this space in the shoulder blade. So these muscles, called your rhomboids in particular, become very weak and stretched. So what happens is the more we're on our phone, computer, even reading, all the things that leave us in this position are really going to be detrimental to our neck and posture over time. So the goal is, even if you can get to this point and just feel what it feels to open up these and then also kind of engage that backside, is huge. If you can do these a couple times a day, again, if it hurts, maybe just pause on it. Assuming you've been able to do these a couple times a day, after doing the hummingbirds, usually what I suggest to patients is, one, if you're struggling with posture and you don't know what it feels like to have good posture, and you notice that maybe you're always in kind of a rounded position, the hummingbirds are also really nice to let you know, oh, this is what good posture feels like. It opens up the shoulders, brings your blades together, kind of allows the natural curve of your low back spine to come in, which is huge as well. So if you're just looking for posture, as far as this isn't pain, you just want to figure out where am I at in space, how does my posture look, just simply doing the hummingbird will kind of give you that idea. So again, after doing a couple hummingbirds, you kind of want to put your arms by your side, maintaining that good posture. And this is not my favorite one to give, and I'm sure on camera it's going to look even better, but this is called turtles, and it's for a reason. So give yourself a double chin. So while you're here, you want to take your chin and you want to go backwards. So you go super sexy. So what you want to feel when you're doing this is the back side of your muscles of your neck start to engage and tighten, not in a painful way, but in a way that says, oh, hey, I'm being utilized, I'm waking up, and things like that. So definitely making sure chin back. If you want, you can always put your head in your hand and kind of do that too. Again, if you have shoulder issues, this might be a little bit difficult. Again, if it hurts, pause, don't do it. So those are the two things that I give first and foremost, hummingbirds and then the turtles. Next, sorry, my dog is over there. Next, I give you guys what I call neck rolls. It's not necessarily an exercise, but it's something that can help hopefully reestablish the curve in your neck. So again, going back to one of the reasons you might have the kink in your neck or you've slept wrong is the curve in your neck. There are two major curves in your spine, a lordotic at your cervical and your lumbar, meaning a backward C, as well as a kyphotic in the mid back. So between these two, which is this is over exaggerated, but call it a true C curve. So the lordotic curves are two big major curves that we want to make sure we don't lose and we continue to establish them. So for the neck, what we're gonna do is you have a couple options with this one. So I call it the neck roll exercise. I'm sure maybe if you've ever been to a chiropractor, they've told you something along these lines. So I tell patients, you can do a couple things. Grab a washcloth, dry, not wet. And depending on your size, I'm a little bit more petite. So if you're a little bit more of a larger human, then maybe grab something like a hand towel, or maybe you could take two of these and roll them together. So the goal would be you take your washcloth and then you roll it up. And what you're gonna do is you're going to, and I'll demonstrate this in a minute, you're gonna take your washcloth. I've also really enjoyed, and my best friend Karen actually turned me on to this, was the pool noodles. You can actually get pool noodles and cut them up, and they're almost the perfect size for what this exercise is, or stretch is indicated for. So whatever you choose, just make sure, again, Goldilocks it. Please don't get something that's too big for you, because again, it's not a no pain, no gain. It's not go big or go home. It's what's right for your body, because everybody is different. So I'm gonna be on the floor and I'll show you this in a second, okay? But what it is you wanna put this under your neck, roughly around like mid-neck area. And then you're going to lay on your back. You're gonna let this go, obviously I'm holding this for now. You're gonna lay on your back and you're gonna let your head kind of hang backwards on this washcloth. So I'll meet you on the floor and show you what that looks like. Your appropriately sized roll, neck roll, washcloth, whatever. You wanna lay on your back, you grab this, place it under your neck. And again, this one isn't my size, so apologies at the moment. But you wanna make sure your curve is supported, but also it's big enough that it's causing your neck to kind of, your chin to go up towards the ceiling. You don't want this. You want a nice curve back here. It shouldn't hurt, but it should also, assuming you're somebody that gets neck kinks and things like that, it might be a little bit different or weird. So again, you want to have a nice support back here. You can go back, get that pool noodle. But again, you're gonna lay here. You can keep your knees bent or flat, whatever feels comfortable for you. The goal for this one is, again, working on that curve, letting your muscles in the front of your neck open up and let that curve kind of get reestablished. Generally for this one, as long as it's not painful, I tell patients to start between roughly around 3 minutes. If it feels at 3 minutes that it was too much, like you got a headache, it increased your neck pain, or things just felt weird, back off, maybe start at a minute or 2 minutes, and then gradually work your way up. You want to stay at whatever time frame, like if you start at 3 minutes and you feel that's comfortable, maybe start for a couple weeks at that, and slowly work your way up to maybe total 15 minutes, but I wouldn't exceed 15 minutes if you can. The other options are, you can, if you have a couch where you can lay on and let your head hang off the back, same with bed. lay on your bed and let the head hang back off the side of it. So that way your neck is just basically kind of going completely backwards. I'll be honest, for me, I have a little bit more ligament laxity in my neck, so that one becomes a little bit too intense for me. And I usually can only do that for about 2 minutes, as it tends to kind of give me a little bit of a headache. It's just a little bit too much for me. And if you have any type of, call it disorders where you pass out, dizziness, things like that, vertigo, I would probably stay away from those. I would use more of the washcloth, pool noodle, those types of things. So again, probably not 15 minutes on the one where you hang your head off the back of the couch or bed. Probably maybe more like 5, maybe 10. But I would play that one by ear, and also reach out to your healthcare provider and make sure it's something that is appropriate for you before you start that one. Okay, cool. So moving on to the next one. Okay, so for one of the other exercises or stretches that I like to give patients with some neck pain is again, it kind of goes back to really opening up the curve in the back of the neck and stretching these front muscles. So this one seems a little bit silly, but I find it works for me, so I might as well pass along the information. So for this one, it's really, really simple, and it's something I tell patients on a daily basis, that if you're sitting at your computer, you can either write a sticky note or set an alarm. I have 1,000 of them. My mother tells me all the time I have too many alarms, but they help me remember what to do. So whatever works for you. But technically, typically what I tell you guys is maybe every hour, or when you can remember it, especially if you're looking at a computer. And again, ergonomics on the computer is something we can talk about in a minute. But that aside, if you can do this every couple of hours or whenever you can remember, so what you do is you close your mouth, and I like to put my tongue at the roof of my mouth because it lets me get a little bit better stretch. And I'll do this to the side in a minute. But I close my mouth, put my tongue on the roof of my mouth, and look up. So you really feel it, especially when you close your mouth. Kind of hard to describe right now when I'm talking, but if you close your mouth, you're gonna feel the stretch right in here, which there's a bunch of muscles in there. I won't go into that nitty gritty. I'll put some pictures up maybe to show you exactly what we're looking at. But this is a really nice one to stretch these muscles. Oftentimes I get patients that come in with jaw pain as well as ear pain. And it's not, obviously at that point, if it's ear pain, it's not an ear infection or anything like that. But what happens is muscles that originate in this area, again, going back to this SCM or sternocleidomastoid, it attaches the back of your skull and attaches all the way down to this clavicle. So with that being said, as well as the upper trap that you get that attaches all the way up in here as well, and as well, again, going SCM, or scalenes in here, a lot of the times trigger points that originate in these muscles, because we're doing this and tightening them so much and rounding out our shoulders, what happens is a lot of the times those trigger points, while they're coming from the muscles, they actually have weird referral points. So in this case, the SCM or and upper trap tend to get this weird like facial pain as well as ear pain, and patients will be like, my ear's been blocked for a couple weeks, or I've had this like annoying, like feels like there's water in your ear. A lot of the times I find is SCM as well as upper trap trigger points. So that's really important to know, and I'll give you a stretch for a couple of those as well. So again, just looking up, closing your mouth, roof at the top, or tongue to the roof of your mouth, and just let that stretch. So from the side, that looks like my hair. Okay. Quickly talk about ergonomics regarding desks and things like that. And I'll maybe show you guys what we have at our home office. It's a little still in work progress, but what I tell patients is if you're working from home, or even if you're able or fortunate to not have to work from home, or I guess whichever way whether you like to work from home or not, either way, your ergonomic desk situation, whether it be for low back or neck, because both are very important, you want to make sure if you can have a standing desk or a desk that can go up and down, that's honestly, in my opinion, one of the best ways to go, because you have the option to sit and stand. I tell patients, if you've sat for a majority of your life in your work situation and you want to move towards a more ergonomic situation, if you've sat for 100% of the day, moving to 100% standing is not ideal for both neck and back and just body. Your body's gonna hate you, and then you're gonna hate me. I tell patients you work like 90-10, 80-20, 60-40, like you move up till maybe you're about half and half standing, sitting, and then maybe even more standing versus sitting. So the reason behind that is because we get in these flex positions. Not good for your body. The other thing is even if you do have a standing desk, or let's say you're ergonomically positioned at your desk, even seated or sitting down, and your chair is nice, you have the nice curve in your back, you're nice and like forward, and make sure for like us, again, vertically challenged individuals, a lot of the desks and keyboard situations don't work for us because we end up doing just a little bit raised elevation, which again, that's going to raise that upper trap and give you some wicked neck pain. So with that in mind, I tell a lot of my patients, if you're working with a laptop or even sometimes a monitor, if you can put, maybe there's awesome, and I'll put some references in the at the end of laptops where you can get the things that angle your laptop up, so that way you can kind of type down here and you're looking just a little bit up. I tell patients I'd rather you have just a little bit of elevation, not this of course, but neutral is this, just a little bit elevation is a little bit better, so that way if you happen to get tired throughout the day and you kind of go back to neutral, at least you're neutral. So same thing with a monitor, maybe put a book or something underneath, or figure it out. If you're working from home and you have to work from a countertop, just figuring out how you're staying straight or a little bit above with your head. Your arms are nice and low and you're not raised, and you're not slouching, or even if you're standing, you're not leaning to one side. Again, that matters as well. You're standing nice and centered and straight. It's hugely important. Okay, so one of the last stretches, tips, tricks I'm gonna give you for today would be something to stretch your neck, shoulder area would be. So on this one, again, you can always just start good posture, shoulders back, chest out. What you can do is just do gentle stretches. Again, if you're in a very acute stage where you can barely tilt, this is what I'm just gonna say is just gently stretching. Before you do this, you might wanna add some ice and heat. So 20-minute ice, 20-minute heat, and then try doing these stretches. It'll help loosen up everything. But again, just kind of gently stretching. If that doesn't feel like it's getting as intense as you want it to be, or you think you can go a little bit further, what you can do is as you tilt, you can take your other arm that you're stretching, so you're stretching to the opposite side, you take your arm and you do a gentle traction kind of at an angle, and you'll start to really feel that upper trap area kind of stretch. So again, this shouldn't be no pain, no gain. It shouldn't be too intense. It shouldn't make things worse. It should make things better. Again, both sides. And if you also want to do, you can raise your arm up just a little bit too, and then pull a little bit down, and you'll get a little bit deeper in different areas too. The other thing is you can take your hand behind your back, nice and tall, and then stretch in this way. This one's going to get a little bit of that deltoid as well. Again, remember to take these things easy. If you have a medical provider, make sure you reach out to them before you do any of these, or if anything starts to increase, back off and reach out to your medical provider or your healthcare provider. Don't forget to follow for more tips and tricks, and don't be afraid to reach out. So thanks again for coming, and I hope these help you in your future endeavors, and hopefully they become less of a future occurrence and don't become such a pain in the neck. All right, guys, namaste, have a great one, and thanks for coming. Bye.